Hi everyone, my name is Riddhi. I'm one of the speech pathologists here at Network Speech Pathology. Today I'll be talking about the Masako Exercise, which is a swallowing rehabilitation exercise commonly used by speech pathologists. We'll look at how a normal swallow works, why we use the Masako exercise, how to perform it correctly, and some important safety considerations. So, the normal swallow. To understand why we use the Masako exercise, it is helpful to first understand what normally happens during swallowing. So, during a normal swallow, the base of tongue moves backwards to make a firm contact with the back wall of the throat, also known as the pharyngeal wall. This contact creates pressure that helps food and fluids efficiently push through the throat and into the esophagus. If this movement is reduced or weakened, swallowing becomes less efficient, and food or fluid may remain in the throat after swallow, increasing the risk of aspiration on subsequent swallows. Why the Masako? The Masako exercise is designed to strengthen the muscles at the base of the tongue and improve contact between the tongue and the pharyngeal wall during swallowing. By deliberately preventing the tongue from moving normally during the exercise, the muscles at the back of the tongue have to work a bit harder to complete the swallow. This exercise is typically prescribed for people who have reduced tongue base retraction and experience pharyngeal residue after swallowing. It's important to remember that this exercise is not appropriate for everybody. It should only be used after being recommended by a speech pathologist. All right, so now let's go through how to perform the exercise. First, gently stick out your tongue beyond your lips. So I'll give you a demo in a second. Hold the tip of your tongue lightly between your lips or your front teeth, not hard enough to cause pain. And keeping your tongue in that position, swallow your saliva. So let's have a go. So holding the tip of your tongue lightly between your lips. Okay, let's do that again. So that's one repetition. So sticking out your tongue, holding it gently, and then swallow. Okay. Most people notice that this feels much harder than a normal swallow, and that's exactly what we want. The increased effort is what helps strengthen the swallow muscles over time. Some tips, so just a few practical tips that can make this exercise a bit easier. Some people find that they don't produce enough saliva to complete several repetitions, and if that happens, they can take a small sip of water between reps to sort of have some moisture in the mouth. However, it is also important not to perform the swallow with water or food in the mouth. This exercise should always be completed with using only saliva. And if someone finds this exercise too difficult initially, a modified version can be used by resting the tongue against the inside of the front teeth before swallowing. So just holding your tongue behind your teeth. And as strength improves, you can gradually progress to the standard technique with your tongue out. Okay, when to stop? The Masako exercise should feel effortful, but it should not be painful. If the person experiences pain, discomfort, dizziness, coughing that doesn't quite settle, or any concerns while completing the exercise, you should stop and contact your speech pathologist. And as with any rehabilitation exercise, correct technique is more important than completing a large number of repetitions. More resources are available from this website. And thank you so much for listening. If you have any questions about the Masako exercise or swallow therapy in general, please feel free to reach out. Thank you. Thank you so much for listening.